Hello, this is Cameron Sabat from Cutting to the Case, and today I'm joined by Dr. Amanda Henderson. She is Chief of the Division of Neuro-Ophthalmology at the Wilmer Eye Institute of Johns Hopkins University School of Medicine, and she holds the Frank B. Walsh Professorship in the field. She completed her ophthalmology residency at the Medical College of Georgia and a fellowship in neuro-ophthalmology at the famed Bascom Palmer Institute in Miami. Her clinical expertise spans optic neuropathies, visual field disorders, and the intersection of eye and brain health. And she leads cutting-edge research using big data and quality improvement methods in neuro-ophthalmology care. Beyond her clinical and research roles, Dr. Henderson serves as Associate Ophthalmology Residency Program Director and Neuro-Ophthalmology Fellowship Director at Johns Hopkins, demonstrating her commitment to training the next generation of specialists. With a blend of deep scientific insight, patient-centered care, and educational leadership, Dr. Henderson is shaping the future of neuro-ophthalmology. Thank you very much for joining us today.
Thanks for having me. That was a very kind introduction.
Of course. So I wanted to start out with your journey to neuro-ophthalmology. Could you kindly walk our audience through that?
Sure. I think, like many people, my journey to neuro-ophthalmology is sort of a story of mentors that I was lucky enough to encounter. I went to medical school at Emory and had intended to sort of go the neurology route, and then met some of the neuro-ophthalmologists there early in my med school and got involved in some of their research, and they were very kind to sort of guide me toward ophthalmology and neuro-ophthalmology. And so when I headed to ophthalmology residency, I intended to pursue neuro-ophthalmology, which I did.
Of course. And you know that's quite a unique and very subspecialized path. So that's really incredible. And you've been doing a lot of very interesting research as well. And so I'd love for you to talk a little bit about maybe how you've developed an ML, a machine learning clinical decision support model to triage patients coming in with papilledema.
Thanks for asking about our research. You know, one thing we try to focus on in neuro-ophthalmology at Wilmer is really high-value care, and how we can develop pathways to promote high-value care. And in doing so, one thing that we've worked toward is trying to work up some of our patients as outpatients in ways that are more efficient for the patient and also for the health system. And as you allude to, as part of this, we're working on developing a clinical decision support model to help with triaging patients who are presenting with optic nerve edema or papilledema as to whether they need to go the emergency room route because there's something potentially urgent going on, or whether they might be able to head down what we refer to as the STAT outpatient pathway, where they're able to get an expedited workup as an outpatient, but avoid the ER and the associated costs and time that costs the patient.
Yes, time, resources, those are all of limited supply in any hospital environment. So triaging is important for workforce efficiency and everything. Yeah, I really appreciate it. And, final question. What advice would you have for our audience of medical students and trainees and future ophthalmologists?
I always say I don't know if I'm qualified to give advice, but I think the one thing I would say is just pursue what you love and pursue what you're interested in. You don't have to be the best at everything, but I think capitalizing on your strengths and learning as much as you can in those areas can really lead to a successful and fulfilling career.
Absolutely. Thank you very much.
Thank you.
I appreciate it. This is Cameron Sabat from Cutting to the Case, signing off.